Call it Pop Bubba Sparks.
Booty, booty,
Yeah.
booty, booty, rockin' everywhere. Booty, 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 rockin' everywhere. Booty, booty.
What's up YouTube, it's Desi and I'm back with another video, you guys. I want to start off by saying good morning to everybody. To everyone that's going ahead and starting medical assistant school, I'm hoping everybody do good. As far as for you, go ahead and starting off your medical assistant job, I hope everybody does good. This video is particularly just to ask as far as for like, should I go back to school as far as for nursing? I know that nursing is becoming a big thing as far as for medical field. It's so easy for everybody to want to become a nurse, but as far as putting the work in for to become a nurse is like the main concern that I really have. It's a lot of questions and stuff that I still want answered before I want to jump into the field of becoming a nurse. I feel like within the next 2 years, I'll already, start enrolling as far as for becoming a nurse and whatnot. I just want to go over just a couple of facts and stuff like that just to go over with you guys. The main nursing that I'm trying to become is the LPN, and the LPN is pretty much a licensed practical nurse. It's a nurse who cares for people who are sick, injured, or disabled. LPNs examine patients, observe symptoms, and assist in wound care. LPNs work in home health care, hospitals, clinics, and nursing homes. A fun fact is actually in Cali and Texas, LPN are known as LVN, which is licensed vocational nurse. I wouldn't mind being that either, to be honest. I would love to be a traveling nurse if so. I know they make plenty of money. The reason why, one thing I can say is that when becoming an LPN, it takes up to 9 to 18 months of the program, and then you have to pass, of course, the license assessment paper. The topic varies as far as from like food, nutrition, first aid, psychology, anatomy, chemistry, biology, the fundamentals of nursing. It all just depends. So there's more that I'm still learning as far as for the topic. It also says on here that LPNs work underneath the supervision of RNs and doctors. The scope of practice is limited. The salary is like $42,000 to $51,000 a year. That's only in Florida, and you get paid at least like $25 hourly. The highest paid states are Connecticut, that's like $55,000. You got Rhode Island, $55,000. DC, that's $55,000. Massachusetts and Alaska. Those are the top high-end paying states as far as for LPN. Now, however, so as far as for my timeline, I had completed medical assistant school and still quite in the field for a minute. I completed the school around when I was around age 20. With me being 22 now, at least by like 23, I really want to go ahead and start off like being enrolled as far as for nursing. I have been looking up like different hospitals and stuff like that that's willing to pay. Surgical tech has caught my attention as well too, but I'm more so leaning towards nursing because I'm trying to like go long term. I want to be able to advance more. There's not really as much advancement when it comes to surgical tech, so those are the type of things that I look at. Alright, so YouTube, some of my biggest concern is, am I still smart enough to go to school for nursing? I sometimes wonder, do people ever get the urge to feel as if like, do they feel like they're smart enough to still kind of go back to school for nursing and stuff like that, because it's so much that you have to know. I feel like a lot of people drop out because of this reason, because they feel as if like it's so much work. And like looking at some of the people vlogs and stuff like that, they make nursing school look like it's so easy and stuff like that. And it's like, I know I'm capable of it, but I still want to like set a certain goal for me, you know what I'm saying, like a certain bracket that I'm able to achieve. Alright, so YouTube, so just to make it clear, as far as for like going back to school for nursing, nevertheless, if I'm saying like it's like, I'm dumb or anything like that to go, it's just, to me, I feel as if like when it comes to nursing, it's a lot to know. And it's like, when preparing myself for that, I want to be able to know like every last little bit, every resource that I can use before trying to like jump myself into that field. I look at it this way. So I went to school, I started medical assistant school as soon as I got out of high school. And, I was in the field for quite a while. I look at also like my age too, because at a certain age, I want to have like a certain amount of things done. I feel like, with me completing medical assistant school, okay, I'm 22 right now, what more can I do? And I already kind of got my experience as far as with phlebotomy. I got my certification for that. I have my thing for medical assistant. So, all those tie in, and it's like it makes me want to do more. I do like to get people input as far as for like, if you already been a surgical tech, what is it like? What do you feel as if what's the hardest part and stuff like that? I would love for some of y'all to kind of like leave your feedbacks like in the comments below. If you already a registered nurse, or if you already a LPN nurse, one of the few that I'm already looking into doing, let me know more so as far as for what to expect. I watch people videos and stuff like that, but I know sometimes on YouTube people just want to tell you what you want to hear. I really be wanting to know the exact thing, like what exactly I'm getting myself into. I also look at like videos where people talk about like the nursing exam, the NCLX exam or something like that. I like to see people output as far as for that as well too, like letting us know how hard it is and stuff like that. Even some of our patients that come in here, they're already registered nurses, so they give me their input on that as well too. For the meantime, I have been looking up like hospitals that's able to pay for the schooling, because in order for me to go back to school, I really want somebody to pay for it. Like that's why I have military like on the back end of like what I'm trying to do, because at the end of the day, I really would love for like my schooling to be paid for. I feel as if I don't want to put myself in a predicament where it's like I have to keep getting loans or anything like that. Like I really want to do everything smart, and until I feel like I'll have like enough information on what I need to do, then I'll go ahead and start that career. But however, I really am looking towards becoming either LPN or RN. A lot of people always tell me they can picture me being an RN and whatnot. That's long-term goals. I just really need the money when it comes to schooling. But again, like I say, I just love how like RN is always going to be the main goal that every girl wants to be. But I feel as if like, look and really do your research. You don't want to be one of those statistics that drop out. You don't want to be one of that. And also another thing is, you don't want to be one of those girls that go ahead and start the school and then within like 2 modules you don't want to finish it anymore either. You know, you don't want to be the girl that just want to join RN school or join nursing school just for the drama. I really want to like sit back and learn and make more videos for you guys to like know on certain things, to really know what you're getting yourself into. So this is just a video just to let you guys know like, what are your thoughts as far as for nursing? Do you feel as if sometimes like you're not as smart enough when it comes to like coming back to that topic? And when I mean like smart enough, not like mentally, like smart enough like when it comes to like the emotions, because I'm one of those type of person where I feel as if like if it's so much work and stuff being put onto me, I can sometimes get so upset on that. Or if I feel as if like I'm not doing so good on a topic, I get upset as far as with that too. So I just want to know you guys' feedback on that. I'm hoping everybody having a good Tuesday. And if y'all have any questions or anything like that, leave it in the comments below, because your girl will be checking them. Y'all have a good one. Peace, y'all.